Most Parkinson's medications work by either raising dopamine levels or broadly stimulating dopamine receptors throughout the brain. Tavapadon takes a fundamentally different approach, and that's exactly what we'll be exploring today. Conventional medications tend to target dopamine receptors in a general, non-selective way, aiming to increase overall dopamine activity. Tavapadon, by contrast, is engineered to activate the correct dopamine pathway in a highly precise manner, without overstimulating other dopamine receptors elsewhere in the brain. That specificity is what makes it genuinely stand out. To appreciate how Tavapadon works, it helps to briefly review how dopamine pathways govern movement in the brain. There are several dopamine receptors, but the most relevant ones for motor function are D1, D2, and D3. D1 receptors belong to the direct go pathway, which helps initiate movement. The indirect pathway, operating primarily through D2 and D3 receptors, functions like a built-in stop signal that regulates and moderates movement. In Parkinson's disease, dopamine production declines, but equally important is that the balance between these two pathways becomes disrupted. The go signal weakens while the stop signal grows overly dominant, creating an imbalance that underlies symptoms such as slow movement, reduced range of motion, rigidity, freezing episodes, and difficulty starting voluntary actions. Traditional dopamine agonists currently available, including pramipexole, ropinirole, and rotigotine, have been the standard of care for years. These agents primarily stimulate D2 and D3 receptors. While that can provide symptomatic relief, the approach lacks selectivity. Because D2 and D3 receptors are also involved in reward processing and impulse regulation, these medications carry well-known risks. Compulsive behaviors such as gambling, hallucinations, and sudden-onset sleep episodes. This is a critical limitation that Tavapadon was designed to address. Tavapadon is a newer dopamine agonist that became available in late 2025. Its defining characteristic is that it primarily targets the D1 receptor, the direct go pathway responsible for initiating movement. Activating D1 receptors essentially switches the motor pathway on directly. A useful comparison. Traditional dopamine agonists are like pressing the brake and hoping the car moves forward, whereas D1 activation presses the accelerator directly. Many specialists are watching this drug closely because of its targeted mechanism and the potential clinical advantages it may offer. Early data suggests Tavapadon could deliver meaningful symptom improvement while producing fewer of the side effects typically associated with conventional dopamine agonists. Another key distinction is that Tavapadon is a partial agonist. This means it delivers a controlled, measured level of receptor stimulation, unlike traditional full-strength dopamine agonists. Over time, intense stimulation from full agonists can cause receptor desensitization, sometimes called receptor burnout, where receptors become progressively less responsive to the drug, reducing its therapeutic effect. Tavapadon works differently. A useful analogy is a dimmer switch versus a simple on-off switch. As a partial agonist, it provides just enough activation to engage the receptor without overwhelming it. This controlled stimulation is designed to preserve receptor responsiveness over the long term, potentially helping the medication maintain its effectiveness longer. This partial activation strategy is intended not only to sustain effectiveness, but also to reduce the risk of common adverse effects. Critically, Tavapadon avoids significant stimulation of D2 and D3 receptors, the ones linked to impulse control disorders, hallucinations, and addictive behaviors. By concentrating primarily on the D1 receptor, the goal is to achieve improved motor control with fewer psychiatric and behavioral complications. Now, comparing Tavapadon to levodopa, the current gold standard treatment for Parkinson's, is instructive. Levodopa works by increasing dopamine levels across the entire brain. It is powerful and effective but nonspecific, and long-term use is associated with complications such as dyskinesia. Tavapadon does not raise general dopamine levels. Instead, It selectively engages a specific dopamine receptors most critical for motor control, offering a more targeted and precise therapeutic approach. The core takeaway is that tavapadon is not simply another dopamine agonist. It represents an advancement in treatment precision, a fine-tuned D1 receptor partial agonist designed to restore movement while minimizing stimulation of the reward and impulse circuits that cause problems with older medications. This profile makes tavapadon a promising option, particularly as an add-on therapy alongside carbidopa-levodopa, with the potential to improve motor symptoms without requiring continuous increases in levodopa dosage. While medications are an important part of Parkinson's management, they shouldn't be the sole focus. That said, when medications are used, they should be as precise and well-designed as possible, and tavapadon may be among the better examples we've seen to date. If you participated in clinical trials or are currently taking tavapadon, sharing your experience in the comments would be greatly appreciated. Your insights are valuable. Thanks for watching, stay empowered, and we'll see you next time.